So, of course, there is this problem of the duration of therapy. We don't know if we should do 1 year for everyone, 2 years for everyone. But the other question is, do we need to combine Nivolumab plus Ipilimumab for every patient? Because there is an FDA approval for MTPD1 alone in first line with Pembrolizumab alone in first line. And the question is, for these patients treated with Pembrolizumab alone, for the patient that have disease progression under anti-PD-1, could we treat them with anti-CTLA-4 plus anti-PD-1? So this is the other question that remains to be explored. What is how we can rescue patients that progress under anti-PD-1 therapy, and maybe we could use combinations of immune checkpoint inhibitors for these patients. This is the question that remains to be resolved.